We do have Nancy Kelly. Nancy Kelly, you are the program director for the Missouri Foundation for Health. Good morning, Nancy Kelly.
Good morning. Sorry to disappoint you for not being there in person. I wish I could have made that happen.
We thought you were bringing donuts, and that's why you were coming on the show, but I guess not. All right. The Missouri Health Insurance Marketplace, a.k.a. the Affordable Care Act, a.k.a. Obamacare. Now's the time to sign up?
Yes, it is open enrollment. People have until December 15th. And so an important thing to know is most people get their health insurance through work or through a program like Medicaid or Medicare. But for everyone else, maybe you're self-employed, different situations, you need to have coverage. The individual mandate's in place, so we want everyone to check it out at healthcare.gov before December 15th.
Now, Nancy, a lot of people have said, I've heard people say, I didn't vote for it, I don't like Obama, I need insurance, but I'm not going to sign up for it.
Well, that might be true. However, the ACA, a lot of people call it Obamacare, it is the law of the land, and there's been a lot of news, a lot of talk about changes. Right now, nothing's really changed. The law is there, and it offers health coverage. It also has a mandate that says you need to be covered.
Right. Now, we're also hearing that people are signing up now more than ever.
Yes, we've been pleasantly surprised. People are going to healthcare.gov. They are finding plans. The thing in Missouri, there are options in every county. It depends on a couple things, where you live, what your income is, what your family size. But, we've heard a lot about premiums going up. It has for some. Others actually are seeing a drop. And then the important thing about that is over 80% of people, so 4 out of 5 Missourians, do qualify for tax credits that actually offsets those increases. So people are actually maybe finding plans that aren't any more expensive than they have been in the past.
What's if I haven't signed up before, and I can sign up now? That's the whole idea to this, right?
Absolutely. So we want both people to go. So people have coverage for 2017 through the Missouri Marketplace. We want you to go back, make sure what you've got still fits for you, or maybe something's changed. You want to look at your options. But new people are welcome. Anybody that needs coverage can go to healthcare.gov and look at what plans are available.
What do you say to the person who says, I hate government-run healthcare, I don't want to do it? What do you tell them?
I would tell them these are not government-run plans. These are companies you would recognize, like Cigna, Anthem, Ambetter, which is also run by a company called Centene. So those are familiar corporate insurance companies. So these are plans that also sell to employers. It's not a government program.
Yeah, no, it's not a government program. You're going to see the same doctors as everybody else. It's just the mechanism to buy insurance, because you're not getting insurance. It's a way to buy insurance as opposed to a way you would buy insurance through your employer's different. This is a different way to buy insurance on the open market, if you will.
Absolutely. The marketplace at healthcare.gov was set up just for that, so that folks can access those plans. And also the tax credits. You need to go to healthcare.gov, put in some basic information, and you find out how much you're going to get help paying for those plans.
The gold, the silver, the bronze plan. Is the bronze plan just, if I get cancer, I have to pay, but I don't get any service? What's the difference between the other 3 different plans?
Yeah, so you're mentioning the plans are divided into what they call metal levels, bronze, silver, gold. So essentially, a bronze plan is going to be the cheapest every month. So your premiums every month are going to be pretty low, but you are probably going to have a high deductible, have to pay a lot out of your pocket before that insurance starts kicking in. You kind of go up. Silver is a little more expensive, but it's going to help you sooner in terms of what they call co-insurance, helping you to pay your bills. And then gold, a little bit more a month, but then you may have a lot lower of a deductible. So it kind of depends on somebody's living situation, what their health is. If you really don't think you're going to need it, you really want it for basic preventive care, and maybe, if you have an accident or if you get really, really sick, The bronze might be the way to go. However, if you have some ongoing medical concerns or you think you're going to be going to the doctor getting a lot of meds over the year, you might get a better value with the silver or a gold plan.
And it's interesting to note, Nancy Kelly of the Missouri Foundation for Health, is that whichever plan you choose, they all cover everything, right?
Right, and so part of the ACA, Obamacare, has something called essential health benefits. So every plan is required to cover certain things like hospitalizations, mental health coverage, your regular doctor visits. There's a package that every insurance plan has to offer.
Right, there's a minimum. Every plan must offer this, and they all cover it.
Yes, and so it makes it a little bit easier to compare. There's going to be some differences in deductibles, like I said, but and one thing for people to pay attention to that will be different from plan to plan is the provider network. So if you have a specific doctor you want to see or a specific facility, hospital, whatever that you want to go to, it's really important to look at those provider networks under each plan because those are going to change, depending on which plan you look at.
Yeah, I know Kevin Lloyd, we do a show on the weekends about this, and he keeps telling people the subsidy is not about how much money you have in the bank or how healthy and or sick you are. It's based on your current year's income.
Absolutely. So it doesn't look at what people call assets, which is your house or your savings. It doesn't look at your health condition. The only factor they look at related to health is whether or not you're a smoker. Anything else is not even considered. You do not have to share that information when you're getting your tax credit.
Because they can charge more for a smoker.
That is true.
Yeah.
Yes.
When's the last day we can register?
So December 15th, that is a week from this Friday. So I know people are really busy with shopping and whatever, getting ready for holidays. So I would say while you're online and you're doing your shopping, surf on over to healthcare.gov. Look at your options. If you get confused or you have questions, there's one more site I will give you, which is covermissouri.org. There is a find local help tool. So there are people who will work for free. They're certified. They are there to help you answer questions and figure out what's the best health plan for you.
Nancy Kelly, what do you tell the 30-year-old who is relatively healthy who says, I'll just pay the fine?
Well, insurance is a safety net. It is a security. It's sort of like your car insurance. You don't ever think you're going to be in an accident, and then something does happen. And so it is that safety net that is going to keep you from really thousands and tens of thousands of dollars of possible medical debt that you totally did not expect. The other thing is we do feel like there are benefits just to being covered, such as preventive care, getting screenings, getting flu shots, all those things that would be covered. Just going for a wellness visit, tune up, make sure you're okay.
Yeah. Nancy Kelly, explain to people what the Missouri Foundation for Health is.
Yes, Missouri Foundation for Health is a private nonprofit foundation, and we have a mission to improve the health of the people in the communities in Missouri.
Ryan Barker comes into the studio. How come you didn't come into the studio?
I figured you would tease me on that. Ryan is at a conference. He is helping facilitate a conference. He sends his regards. He put me in. I'm sorry I was a second stringer and didn't show up.
You were a fine stringer. It's just, you sort of small-timed us on the phone. Next time we expect to see you in studio, Nancy.
Okay, you got it.
Thanks, Nancy.